how did you become an oncologist? And the reason why we asked that, well, at least my curiosity around that is when I was at ASCO this year, every single person I talked to who's in the medical oncology field or a medical oncologist, incredibly intelligent, incredibly capable. So there's a huge surface area of things that you could have done. So why become a medical oncologist? It seems like a field that is, you deal a lot with death, you deal a lot with, some of the darker sides of uh, not necessarily humanity, but of just reality. So why did you become a medical oncologist?
Well, thanks for asking. So I actually started young, and I would say it was serendipity. When I was 16 in high school, we had a chance to do a research project, and our school was attached to the University of Toronto, and there was a poster on the wall in the university section that was advertising a research project in biophysics. And that was when I first met Professor Dick Hill. He was a radiobiologist and senior scientist at the Ontario Cancer Institute, which was connected to the Princess Margaret. And I worked with him for the first few summers. Terrible at bench research, but not only did I get to meet him and some amazing physicians and scientists who became oncologists, but also greats like Dr. Ian Tannock and Dr. Fifi Liu all had labs and did research at that time. So that was my initial start. Then, when I was in medicine and doing my training, I really fell in love with the human aspect of oncology. That was a time when really chemotherapy and radiotherapy were what we had for patients. And despite that, patients were grateful. They were grateful that we cared, that we tried, and that their lives and their quality of life mattered to us. So it was very rewarding, much more rewarding than seeing other patients in the emergency department. And so later I went into oncology, and I've been so grateful because really oncology has made extraordinary progress, really bringing bench and bedside closer together. There's been so much scientific advance, even in the 20 plus years that I've been in oncology, that, when I started in lung cancer, chemotherapy was very exciting. And now chemotherapy is what we want to avoid. We're really interested in precision medicine. So tremendous things, and really a watershed time, I think, in oncology.